memorable experience when I worked in the field and there was a small child, one of my clients was going to school for the first time, and it's so frightening when there is a child going to school and they also have special needs. And I grew with him, and as he improved and advanced, he did not walk. When I used to lift him and carry him. And when he graduated from his first school, his parents cried because I had worked with him with the therapist, and he walked to get his diploma. And now I'm his clinical manager, so I still see his advances.
So the first home care client that I brought home as the clinical manager, he was a 23-week preemie. At the time he was 9 months old and he only weighed about 9 pounds or so. He was a very little guy. That was back last year or so. It's been a year now and he's tripled his weight. He sits on my lap and teaches me how to clap my hands, and he's been doing really well and progressing nicely. Had an NG tube, got rid of that. It's just been really amazing to watch his progress, and I'm just as proud as his mother is.
I think one of my fondest memories is a client that came home after 6 months in the hospital. He had an accident and a brain injury, and he had a trach and a feeding tube and was in a wheelchair. And now I've been with that client for 7 years, and he's able to walk, and the feeding tube is gone, and he's enjoying his meals, and it is such a joy to go and visit him each month.
My favorite moment happened just recently. I walked into the office and I had a busy day ahead of me, and my director said to me, "Ann, can you run out and cover a school field trip for me? Because it's a 25th grade students that are a jump roping team, and if the nurse called out, they can't go on their field trip if nobody goes." So I tugged at my heartstrings and I went, and it was nothing technically. I was there just to give an EpiPen if someone needed it. But when I walked on the bus thinking that maybe they were going to be upset, the nurse was late, all the kids cheered that I was there. And it was like really one of my favorite days. And like I said, it wasn't anything technically skillful or anything, but it was one of my best memories, because that's what we try to do, is just make somebody's day better by what we do.
I really, really enjoy what I do. I get so much satisfaction from teaching the home health aid classes. When you start with someone who really has no knowledge base in this field at all, and to watch them flourish, I really enjoy that so much. And so many of my home health aides have gone on to nursing school, and now they're coming back with some experience and now working for us as nurses, and that's like the best thing in the world.
A positive outcome that came from my home care, it was this client that I have who had a stroke, and I met her in the hospital. I happened to be her nurse at the hospital. When she came home, all she could do is say yes or no's, but they were backward. When she meant to say yes, she said no. When she said no, she meant to say yes, and she would get really frustrated. She also wasn't moving as much because of the stroke. She had left-sided weakness. We have a home health aide living in the home, and I've been with her for 2 years. She's able to detect colors and tell you what they are. She's able to hold a little bit of a conversation with you, not just the yes and no's. And she's walking now. It's something that we've been doing with her, and I'm very surprised to see her and see her progress throughout, and knowing that I knew her from the hospital into the home care now.
This one client that I had, he was a 2-year-old boy with hypoplastic left heart syndrome. He was also, due to his religion, he couldn't have all 3 of the surgeries separate because of the risk of losing blood. So they did the second and third procedure together, which was very risky and very scary, but he came out just fine. Then after a while, he no longer needed our services. He was the little blue baby when I got him, and when we discharged him, he was nice and pink and running around and had all this energy, and we had a nice little graduation party for him and his family. Keep in touch, and he's doing well.
I think the best stories that I have are the kiddos that decannulate. We call them the graduates because they're able to actually get out of home care. So it kind of negates the whole home care thing, but we got them there. So the hospital can get them traits and G-tubed and home, but really home care is the one who gets them to the graduation date. So I've had 2 so far since I've been here, and they're the best stories because they are able to resume a normal life, and these kids do great, all because of home care, all because of BAYADA.